немножко отстаем.
We are a little bit behind the schedule. I think, no, everything is on time. Okay, we will proceed to the new panel session. And I would like all the speakers, I have checked the best representative of the mankind is represented here, and the gender balance is not maintained. And I already predict that the main representative will blame us for not maintaining the gender balance. And we invited the prominent scientists and scholars, doctors, who are invited to address and tackle the key issues in the health sector and how we can solve them, how we can address them. If you have any questions, you can address your questions specifically to certain speakers. So 5 minutes, please. The floor is yours for introduction, please. The floor is yours. Alfia Eldarovna. Alfia Eldarovna, the floor is yours. Thank you very much for your hospitality. Of course, we understand the burden which you took on your shoulders, you and Cassia. Thank you very much. Today, I represent Bishkek International Medical Institute, where I'm director. I'm the doctor of medical sciences, and I'm the obstetrician gynecologist. And the topic we have selected for the scientific activity as a general topic of the institute is of control of non-communicable diseases, prevention of risks and management of risks, and the concept of harm reduction is very much in line with our plans as a member of the parliament. Back in 2016, I was engaged in addressing these harm reduction issues, and at our institute, we still continue addressing this harm reduction. When I was invited to host conference in Bishkek, and I would like to extend my great thanks to Cassia and her team. And the 12th international conference is hosted in Bishkek, and here we have the representative of Central Asia and European countries, and they will share their achievements, and they have their own expertise and experience to share with us. And we have representatives from European countries. We have experts from 15 countries to the US, China, Korea, European Union, and Central Asian countries. To what extent this conference, how much it is relevant and how much it is needed in Kyrgyzstan? I would like to say that as Bahit Niyazbekovna said there, mentioned rightfully, only 10% depend on health workers when it comes to health of people. Of course, it is very sad that they always blame doctors for bad equipment, poor service, poor quality of the service, and so on. We are well aware that 10% of the human health depends on medicine and 20% on genetics with which the person was born, and 20% on environment. And all of these issues related to environment. Recently, we are raising the issue of smogs in Bishkek, and the glaciers are melting in Kyrgyzstan, and there are some cases of earthquakes, and the nature is making some adjustments and some floods and rock falls, and all of these adjustments are made by the nature in terms we live, and 50% of the human health depends on the lifestyle of a person. The preventive activities in Kyrgyzstan are very well progressing in the country. The government of the Kyrgyz Republic, in terms of protection of public health, we have the program until 2030, which is called Healthy Person, Prosperous Country. And this program is very well developed with all the indicators and the monitoring and assessment. And evaluation of the achievements. Unfortunately, 80% of mortality death cases relate to non-communicable diseases. Unfortunately, we cannot reduce this high mortality rate due to NCDC, and for us, this conference is very important and critical, and we will absorb the best global practices which generated good positive impacts in their native countries. We invite you for active participation and engagement, and I wish us very fruitful work during these 2 days, and I invite you and encourage you to take part in the development of the resolution of the conference. Alfia Eldarovna, thank you very much. I will start with myself. Nadezhda Mikhailovna, please, not more than 5 minutes. You'll be also acting as a speaker. Petukhova Nadezhda. By my education background, I am the doctor, a physician. I was 3 times member of the city council, and once I was the member of the parliament of the country. And currently, I'm the chairman of the Public Association of the Ministry of Health and the chairman of the board of the Association of Legal Entities, Eurasian Medical Association. And I am also the president of our branch in Astana on sexual and reproductive health. Good morning. I am very much pleased to see all of you. Welcome. Welcome to the sunny Kyrgyzstan. My name is Jildis Bakirova. I'm the Deputy Director on Curative Care of the Republican Center of Psychiatry and Narcology. And I would like to say that with the help of the Ministry of Health, the Republican Center of Psychiatry and Narcology is implementing huge scope of work. If we divide the population into those who just started consuming, using drugs, and there are some who use drugs more frequently, and there is a very little part which become dependent and addicted. And the Republican Center of Narcology and Psychiatry is dealing with this group of drug users. And we have to understand this issue in a much wider context. And it is the cross-cutting issue which concerns all the spheres of the human life. And I will finish on this, and I would like to thank the hosts for the wonderful opportunity to make our presentations and speeches, for the opportunity of networking and seeing new people, and welcome the prominent scientists and scholars, together with whom we are ready to develop our resolutions of the conference and come up with very good solutions. Good morning, good dear participants. Aygul Solovyova, Nadezhda Mikhailovna mentioned that we used to be the members of the parliaments in 2 convocations. Mainly I was engaged in economics, and I support the Association of the Environmental NGOs in Kazakhstan. Green economy is a very fashionable trend nowadays, and we have to preserve the environment, and the environment includes everything, including the clean air, land, soil, biodiversity, and we have working groups and we have experts in each area and field. And I would like to highlight that I have seen that the air is very clean. I have seen the pastures. Today we have been discussing the pastures, and the pastures are in very good condition. The air is very clean. In winter, Bishkek was recognized as one of the worst air quality cities, and they also mentioned about the melting of glaciers. In 2030, we have to be concerned about the deficit of water resources. And as Bakhet Niyazbekovna mentioned, in the center, we have to have the human being, and the public health, to my mind, can become the driving force to change the consciousness and perceptions and insights of the human being. And in Kazakhstan, we have selected the whole range of indicators, and green investments can be returned only if you comply with the principles of three principles: economy, social sector, and environment and lifestyle. And the details of the health sector, maybe bad habits, maybe I'm not well aware of them, but through the lens of environmental development and the global trends, what are the damages? What are the damages to the environment because of non-proper lifestyle? I'm ready and prepared to respond to all of your concerns.
Народный.
Good day, dear participants of the international conference. I'm the representative of Uzbekistan, Ms. Rozalieva. I work as a dean at the Faculty for Public Health. And of course, I am more involved into the educational sector and the training, HR training for the healthcare sector. But as everywhere else worldwide in Uzbekistan, the burden of NCDs is of the healthcare sector. And in Uzbekistan, we are undertaking large-scale initiatives, the public health policy as to the alcohol, tobacco smoking, and drug use issues, a lot of decrees of the president and regulations of the government, and we are introducing actively the international experience as well. So thank you for your attention and for this invitation. Thanks a lot. I have looked through and I can see at our table we are having 5 physicians seated and only one person is not a physician. And today we are discussing environmental issues as one of the challenges contributing to health damages, and finally the humankind is raising its bells and gets alarmed about the future of the civilization. And at this transition point, one millennium to the next one, we are having the diseases emerging due to the environmental conditions. This 12% attributed to the environmental risks will only grow, and therefore soil and air and environmental protection efforts are very funding intensive and effort intensive. Renewable sources of energy require strong political support, and also genetics being crucial for the human health. But this is more obvious in which field to work, but then with the environmental it is even more comprehensive subject. And now we would like to pass the floor to Nurgul Sabarbekovna, who is a PhD in chemical sciences, the author of many papers and articles, and we are happy that now she is with us and will provide some information about the status quo and what should be done. Thanks a lot. I shall try to be brief. not to overload you with information, but we would like to express our gratitude for inviting to this conference. Before, the ecology was given less of attention, but now we are given the top priority focus. And today, Bahut Nizbekovna said that this is not the 13th, but rather the 12th conference. And today we are starting the next cycle. And but this is was a continuous and smooth handover from other regions of the country to this region. And I can see that the climate changes affecting the snow coverage or other processes, but I know that there were some studies in Tajikistan and in Kyrgyzstan. They had the active research activities about the glacier melting. And using this opportunity, I would like to reiterate the importance of governmental efforts to fund such research activities because it is important for the public health to conduct such researches to mitigate the potential water deficit. So in principle, this is the process which shall continue. So the urbanization process covering cities, not only the densely populated, but also less populated urban areas should be given more focus because urbanization and its increase is inevitable. And here sorry, we're having some technical noise. And the most important point, in my opinion, is that the public health is about, first of all, the public awareness. People should be given information. And with the Orcus Convention, which has been ratified by all of the represented countries, this is about the easy access to the information, and this is the holy and sacred right of people. And as to the air pollution, I would like here to say and to speak from the point of view of the environmental organizations talking about PM 2.5 and PM10. And Bishkek is one of the most polluted cities at the winter season. And these particles go directly to the respiratory system, causing the asthma and other nosologies. So human health is exposed to the PM effects, but also to the greenhouse gases and the global warming effects. There are not so many researchers in this field, and I have looked at through, and I can see that according to the report of WHO, the air pollution has led to the death of 8% of mortality cases, and the Texas University from US said that the global air pollution reduces life expectancy almost by 1 year. Talking about the economy context, we should understand what is more cost efficient for us, either to keep living with polluted air or should we balance this with bigger funding to the environmental protection and health protection? And in 4 provinces of Kazakhstan, which was covered by the study, Karaganda, Pavlodar, Eastern Kazakhstan provinces, this is the area where we're having more than 1,000 of newly diagnosed cases of bronchitis, increased hospitalization rate, and higher statistics for the emergency care cases. Preterm mortality, this is 2.8 thousand, and heart and pulmonary diseases have caused 2,600 cases throughout that year, and 183 cancer-attributed mortality cases. Just recently, we had the conference at the Eurasian platform, and we've heard from that the biggest contributing factor was the vapors, but they made the reference to the study which has shown a high number of mortality causes, mortality cases caused by young people using vapors, which I can tell that Almaty is spending $286 million, 181 in Pavlodar, and 171 million in Usk-Minogorsk, $154 million in Temirtau to treat after it's being reactive rather than proactive. So 1.7 of the GDP is spent in order to treat the consequences, and it is even less spent for the education. And the emissions of PM2.5, PM10 are being combined, get mixed with the particles of COVID, according to the recent study. And this implies to the fact that such mixing of the particles lead to the mutation exacerbated after getting into the human body. And the goal of the panel discussions is to collect your questions, and the final draft of the resolution should reflect the necessity to unify the data which we collect on air quality, on environmental pollution. We apply the sanitary norms, but we don't really study the amount of emissions of PM, the different types of PM, and also not talking about the emissions containing lead, but it should be given more attention, and if it's needed, I can formulate some actions which require our attention and action.
2.5 billion in the country is spent in the country to treat the complications caused by these parameters, by this letting alone the warming, global warming, the air pollution, and environmental hazards and so on. And there are some other issues related to climate change, also in immigration, migration of population. People will be looking for places more appropriate for living. And in Central Asia, in all countries in Central Asia, they will be faced by these changes, environmental changes, and public health, and the physicians and doctors should be concerned about this these days. And we have to pay close attention to these issues, to all those who uh, based on harm reduction. This is to do with the human's choice and other factors. And harm reduction is one of the good approaches which we have to use massively. And this harm reduction approach emerged with the emergence of such a disease globally, HIV. HIV cases, the first cases of HIV are those who were with injecting, who inject drugs. And in order to get in order to prevent their the transmission of HIV through injecting, we started distributing the syringes. And in Kazakhstan, we have the increased incidence of HIV, and there are people who hide their status, and there is a threat of getting infected, and they can be the source of transmission. And there is a high stigma, the problem of a very high stigma. And the doctors and physicians should be well aware of this issue, and the patient should be aware of the culture to foster their health, promote their health. And we have the expert here, Juldis Bakirova. We have new psychoactive substances and other, and we have heroin addicted people, and this kind of drug users, and they have long-standing addiction, and which are treated differently by health workers. In different countries, they have different approaches and attitudes toward these chronic pivots. And the number of people who become addicted to NPS, this is a headache and concern not only the healthcare, but also law enforcement agencies and other sectors and agencies. They are engaged in robberies and thieves and other unlawful acts. And these are the collateral effect of drug addiction. And once again, I would like to thank the hosts for this opportunity to present this speech about the harm reduction programs. The Republican Center of Narcology and Psychiatry has been merged last year in 2022 in December. And we started working together. In the past, the Republican Center of Narcology was separate from the Psychiatry Institute. Our areas of activities can be divided into 5 blocks. The first is counseling diagnostic blocks, where we provide consultations and counseling and diagnostics. First, we find out whether the person has a problem or not. And the second area of our work is treatment using different methods and approaches. And another third area is expertise, examination, professional forensic examination, and another fourth area, the children narcology service. And the most important in terms of our achievements, that we have accepted our clients, our customers as drug users, as a person with the diseases. And the drug addiction, we have accepted, acknowledged as a disease, not not because he's a drug user, he becomes the offender, the offender of criminal acts, and we have to acknowledge that this is a disease with a chronic pattern of development. It also affects the sugar diabetes, hypertensive diseases. If the person uh, vi- violates or breaches some of his or her habits, they can control their conditions. If it is a chronic disease, it can be relapses, it can be remissions, and this is a very lengthy chronic disease, lifelong chronic disease. They have to come across with different services because this client has different and diverse needs and demands. And once again, I would like to reiterate, if we divide our population into three large groups, the first are those who use psychoactive substances for the first time. Uh, it includes narcotic drugs, alcohol, and others. If they try it for the first time, those who try it for the first time, for them, we have to conduct separate activities. Those who have the pattern of more frequent use, we have to implement little different interventions. And the third group are people with addiction. They fall under the criteria NCD-10, addiction, and the people with addiction, and they require completely different activities and interventions. Own rights. They want, but they can't. This is the first group. They can and they want and they can. This is the second group, and the third group, those who would like to continue using the psychoactive substances. And these harm reduction programs, we have to reduce the harm of using this psychoactive substances. I would talk about pivots. We propose the syringe exchange points. If you want to continue using drugs, please make sure you use clean syringes. If they want and they can, then we propose them detox programs and the huge lengthy process of rehabilitation. And the biggest pride of ours is that when they want, but they can't, they have implications. These are the groups of people who are under substitution therapy programs. These are the groups of people for whom we offer these substitution therapy programs. For more than 20 years, in 2002, we have launched the substitution therapy programs. We were one of the pioneers in Central Asia. There were lots of concerns, there were lots of problems and challenges, and but gradually we are trying to tackle and address these issues. This substitution therapy program, what we have done, what were the steps? We have to realize whether we have to decide whether we have the problems with opioid addiction. Uh, and also we had to review the legislative framework, regulatory framework, and opioid drugs, base drugs, they have to be regulated legally. Uh, and of course, the lengthy process of implementation. I believe the Kyrgyz experience and practice will be of help to our neighbors, neighboring countries, Kazakhstan, Uzbekistan. Maybe they have some similar challenges when they introduce the substitution therapy programs in their countries. Recently, lately we have another trend, the opposite trend. We have the newly emerging psychoactive substances, NPS, synthetic drugs, and this is a completely different group of people. This can be very young people, completely different approach and different ways of buying these drugs. This means that we have to change, to shift our paradigm in approaching these groups of people. And today, based on our experience and practice on implementing the harm reduction programs, we can see and solve and address together jointly the challenges when it comes to newly emerging NPS, and for us to be well aware about the challenges and problems we can face in the future. And once again, I'm very much happy to see all of you and ready and prepared to respond to all of your questions.
So we shall accept questions at the end of the session, but now I have a question to you. What is the estimated number of PVIDs in your country? And how many of them are taking substitution therapy? And I would like to draw your attention to the goals and objectives of the event. This is not just to report on the situation in the country and the challenges as to the environmental pollution, migration, health issues, but also to discuss the wider range of the areas, and this is including urbanization and also internal migration when villages are being left empty with higher concentration of people in big cities. So how the modern human being can face the challenges and manage it, because it's unavoidable complications to be expected in the future, and the estimated number of PVIDs in Kazakhstan and of HIV cases increased twice over the recent years, and people who inject drugs, 8% of them have HIV infection. In the year 2000, when there was a big conference conducted on HIV infection in Kazakhstan, and that is a pandemic which started in 80s. So we had the number of politicians and well-known public figures who underestimated the threat and were reluctant to support the harm reduction strategy. If 40% of those people who inject drugs, and if they are left without the coverage, then we are in a risky situation. What should be done to improve the efficiency rate? And this harm reduction approach has been launched at those times when these strategies were developed for PVIDs, and over 30 years since 2008, when we started the pilot project, we have accumulated the experience which shows that it should be a more comprehensive approach, including nutrition, cessation of tobacco smoking. And other speakers can make additional comments, not necessarily physicians only, but all participants. What is the percentage coverage in your country? So we have conducted few assessments as to the number of the people who inject drugs. So there were different numbers, like 50,000 and 25,000. So The rapid assessment of the situation indicated the number from 12,000 up to 18,000, but I would like to say that quite often we are being guided about the narcology registration database, and this database, so 8,500, these are the estimated numbers, and 1,500 on MIT, so it's like 11% are being covered. So the opium dependence doesn't grow these days. It stays like plateau number, even maybe with some reduction, because more psychoactive substances are arriving to the country, and the principle which we apply to control dependence, all types of dependence, don't cease to be efficient when it comes to the psychoactive substances. What else I would like to say? So far, you see, we are being guided by the narcology registration database in terms of our numbers. Okay, I have another question, but first I would like to pass the floor to Nadezhda Mikhailovna, so maybe you can give more additional information to the presentations made before. So please share your point of view. Good day, dear participants of the conference. I also would like, first of all, to express our appreciation to the City Health International Forum for organizing this event, and to the Kyrgyz colleagues for excellent conditions and organization. The whole world is facing the question what to do and how to do it so that people have a higher quality of life and longer life expectancy. As Bahit Niazbekovna said, we are so interconnected. The ecology and infection do not have borders, and therefore we should be developing such type of recommendations which would improve the life of quality and preserve the health, and train people to understand, to educate people to understand what are the risk factors and how they should be reduced. In Kazakhstan in 2017, we have established the working group for risk factor reduction, and Bahit Niazbekovna and Galina Alexandrovna, they were part of this working group, and we developed the concept for the healthcare development till 2027. And those recommendations which was issued by this working group has been used by the concept, was integrated to the concept. We also are guided by the important document of our country as a Healthy Nation program, which is a national project which attaches high significance, first of all, to the healthy lifestyle. And you know that healthcare reforms are continuous and never stop. And at some point, we handed over to the private sector all the healthy lifestyle institutions. But just a month ago, the decree of the government was issued, and the working group has been established, and also there is an effort to develop the roadmap in order to reverse it and to give it back, all these agencies and services, to the public sector. Why? Because efficient performance can be guaranteed when you have the governmental control imposed, but also there should be some control from the civil society. So I represent the Public Health Committee, which was established in 2015 based on the law of 2015. So being as a member of the parliament in 2015, we have developed this bill and introduced additional functions to enhance the authorities of the public representative councils, which became the part of the structures of all ministries and municipalities. So there are annual reports issued by this public control institution, and this institution of the public and civil control plays an important role to put into life the concept of the state, which can hear to enhance the connection between the population and the governmental system. Challenges are tremendous today, and the risk factors are getting more alarming because of the environmental pollution, and the nutrition status leaves much more to be desired, and the population has low awareness about the nutrition attributed risk factors. As the labeling of food products is not properly regulated, and we need to improve also the labeling for the pharmaceutical products. Only 7% of pharmaceutical products in Kazakhstan are totally unacceptable for consumption, and producers in the quest for profit forget about the risk mitigating efforts. For example, products for diabetic patients may contain palm oil and also the other oil products which are harmful for the health of diabetic patients. So now we are living at times when the politicians and public figures and the population per se should be actively promoting the questions which are important for the healthy lifestyle. You know, I think it is very important for each and every person understand that punitive nature of efforts will be useless, and only your personal responsibility for your personal lifestyle can improve the quality of the life and life expectancy. Unfortunately for today, and Bahat Newsbekovna, she was right when she commented that, when she said that the upbringing should start from very early age, so that right habits are formed. And at schools, every third child suffers from overweight or obesity. And the most alarming concern is that, according to the study conducted in Almaty, every sixth child had some deformation of the spinal deformation and overweight, and every 25th child had hyper excessive levels of cholesterol. And this used to be the problem of all of elderly generations. So, and if the young generation has such low indicators of the lipid-based exchange, this should be taken very seriously. So we have 22,000 NGOs, and there is an authorized body to work with the NGO sector, and this is the Ministry of Information and Public Development, which issues grant funding to conduct such projects and also consolidates and coordinates the performance of different NGOs in order to improve the environmental parameters to improve nutrition status and to reduce the psychoactive substance use and to reduce, of course, tobacco smoking. And this scope of work is huge, but still there are shortcomings because we always have some politicians who would lobby the interest of certain circles and oligarchy tries to introduce prohibitive and punitive measurements which don't work. And we would be rather undertaking more active public awareness activities. Then so local foundation uses the grant funding to help the GPs and PhD level and they deliver workshops on 6 important subjects such as nutrition, reproductive health, cessation of tobacco smoking, and also fighting with drug use. So if the PhD staff, GPs, those who are closer to the population will be trained on how to conduct high quality informational work, then we will be able to reduce the morbidity and mortality caused by NCDs. And I hope that this conference will give a certain impetus to recognizing the right solutions and fighting with risk factors and to reduce NCD rates. And we should develop such recommendations which would allow all of us to work effectively, first of all, for the benefit of our people and for the future generations to come, and to consolidate our countries in their understanding of ecology problems, nutrition problems, and drug-related issues. They all come as interconnected phenomena of problems, and therefore they would require collective efforts either. You know, I would like to give some examples from my personal life, talking about the palm oil, as Nadezhda Mikhailovna mentioned. You know, I had a very good friend of 90 years old, and he was a lonely person. I would take care sometimes, and every week some magazine was issued on a weekly basis about the artists. And so the shop assistants of those newspaper kiosks knew me well. They would leave me a copy, and at the last page of that magazine, always that was the advertisement of the palm oil. And every month I had to buy the bottles of palm oil because every time I failed to convince the person that it's not good for health. So I would buy it like once a month, the bottle of the palm oil, which he would consume over the months. But as it was mentioned before, this is not to be handled only by GPs. Just checking the number. How many people we have PVIDs who are taking substitution therapy, and it is less than 40%. And why we cannot increase it? Because among the healthcare workers we have low understanding. In the years of 2000, when there was a big conference organized by the government, I was talking to the municipalities, asking to earmark certain funds to purchase syringes to be distributed among PVIDs. And one of the council members told me, why do we need to spend our money for them? Let them just get over injected and die to the society will get only cleaner. And then I've explained that it's not spread only through the injecting ways, it could be also the sexual way of transmission or the blood transfusion transmission. So there is no guarantee and no one is secure. And then when after they did the analysis, finally they have agreed to provide funding for that. And the fact that for today, so it's already more than, it's almost 30 years after the first HIV infection was registered in Kazakhstan, we are still underperforming with harm reduction strategies. So, and I believe that in the future, a harm reduction approach will become more and more global and more demanded in the context of the concerns, alarming concerns we have to observe. So we would like to pass the floor to the speaker from Uzbekistan. Maybe you can speak more about the implementation of the harm reduction approach and what is the perception of the clinical staff. And in nutrition, yes, this is a problem in Kazakhstan. Yes, and this is the problem again with the margarine, yeah, and the pastry which is produced with the use of these trans fats have the expiry date for 6 months, but if it's done without adding this artificial butter, then the expiry date would reduce to 3 months. And therefore we have this resistance. And also you see taxpayers, they are also consumers of these low quality products, and they are becoming potential patients for the public healthcare system. And maybe this also can be reflected in the resolution of the conference.
Microphone, please. Good day, dear participants of the conference. As in other Central Asian countries, in Uzbekistan, we experience the same problems related to NCDs. Such a problem as tobacco smoking is one of the leading challenges and problems. It leaves much to be desired after conducted in 2014 and 2019 with the help of the World Bank and WHO. We have conducted this survey as part of the STEP program. Following the findings of these surveys and studies, when it comes to tobacco smoking, if we compare the data and findings of 2014 and 2019, despite our intensive efforts by the government, by the Ministry of Health, it has been went up, increased from 13% to 16.5%. And such leading risk factors like hypercholesteremia and high blood pressure and the increased consumption of salt is the common problems and challenges in our country. And these surveys showed the growing trends of these diseases. Of course, the government is undertaking large-scale interventions. They developed strategies, concepts, decrees of the government and edicts of the president to improve the health of the population. The approach is implemented involving NGOs, governmental agencies, Ministry of Health,
самоуправления, то есть
and local self-governments. And for the recent 2 years, we have the public association such as Mahala is the compact living of some neighborhood and they were represented in these interventions. This multidisciplinary intersectoral approach can generate and yield very fruitful outcomes. In 2018, the President of the Republic of Uzbekistan has issued the decree in which it reads about the prevention of NCDs and healthy lifestyle. And in other words, in the healthcare system, we have the structure or subdivision, the healthy lifestyle center. Which deals mainly with tobacco smoking, alcohol use, and their prevention. And also, we before my departure to this conference, uh, a week before the holidays, at the level of the Cabinet of Ministers of the Republic of Uzbekistan, they have adopted the development program on health and nutrition and countering the tobacco smoking and alcohol use for 3 years from 2023 until 2027. And these interventions are aimed at restricting and limiting the import of the foods with in terms of content of sugar and fat, and also fostering such area as nutritiology. And at the Tashkent Academy, they trained the dietitians and the nutritiologists, and we have reinforced the control on using the food additives of using this test is equipped with essential equipment, and there are some medical warning signs through different images. For our country, in our country, we experience such a challenge as the young population. As of today, in the Republic of Uzbekistan, the population of the country has reached 36 million. And out of this size of the population, more than 12 million of population are children. And they of school age and adolescence. As of today, as in other countries, the tobacco use, the synthetic drug use, and among the adolescents and teenagers, this is quite an acute and prevalent issue among the young people. And many a wide range of activities by government and the Ministry of Health as the leading agency for addressing these issues, along with the Ministry of Education, Ministry of Secondary Education. We implement the comprehensive set of activities, and two ministries are developing interventions aimed at prevention and raising the awareness of teenagers. As for the tobacco smoking, 16.5% of population are using tobacco, are smoking tobacco. And out of this amount, only 1.1% are women. Mainly this tobacco smoking is prevalent among the male population. As for the alcohol use, over 10, 8 years, our interventions yield very positive outcomes. But for the recent 2 years, we could see the growth of alcohol use and the production of alcohol beverages. Uzbekistan is tobacco smoking, and therefore the government uh, uh, in December, during the session, in December 2022, the lower and higher houses of the parliament, they have adopted the programs to tighten the tobacco and alcohol products, and much tougher control over, and very soon the decree will be signed by the president of our country, and there will be strategy on alcohol, and they will develop the concept on prevention of tobacco smoking. Of course, there are different series of activities, but we believe that jointly we can yield and generate positive outcomes. And we are looking forward that by the end of this conference, we will come up with very positive outcomes and solutions. I would like to thank the participants, and I would like to thank the hosts for inviting us to take part at this conference. Thank you very much. Thank you very much, Рамиль Равкатовна. Elmira Ravkatovna, thank you very much. Very informative, and it is very good that you have a huge younger generation, young people. And there is another problem. Thanks to the medicine and lifestyle, we have to care about the longevity. And there is another problem, less low demographic rates, and some families choose to stay child-free families, and this is a common trend in many countries. Many countries are already experiencing this negative demographic rates in Japan and in Europe, and even in our country, there is a trend to decrease. Okay, here is a question. Can you please introduce yourself? I would like to provide a very short feedback. The birth rate was quite high from 2015 to 2020. The birth rate was going down. 670,000 children were born during this time. And in 21st century, the birth rate went up in the Republic of Uzbekistan. And more than 900,000 children were born during the last year. Thank you very much for your presentation and for your speech. And I use different statistical sources of information. Sergei Stoshnikov, Bukharsky Medical Institute, the solid live in Uzbekistan for more than 1 year, and I can see how the burden of these sweet beverages and soda drinks. One of my colleagues got sick with sugar diabetes mellitus, and I would not like to advertise Coca-Cola, and he was drinking 4 bottles of Coke a day. And I could see that every single child has a Coke in their hands, and every single family has a Coke on their family meal table. So this is something very uncommon. And do you have any projects or any plans to control these soda drinks or the soft beverages? If we don't undertake some actions, there will be very huge impacts and implications. Thank you very much for your question. Yes, we agree. There is a big issue with these soft drinks, sweet drinks. Before my departure to here, the Cabinet of Ministers of the Republic of Uzbekistan. Please, in the hall, can you please stop talking along with the speakers? You are interfering with speakers. Thank you very much. This national movement on a healthy lifestyle as part of the national program and the roadmap of the government. There are several items related to control of obesity in children and the growth of cancer diseases among the children. And Ministry of Health as of today is developing the range of activities and interventions to counter this issue. If the child is drinking something what is not needed, then I think the parents should be penalized for this. I think this is to do with the culture. Uh, there is a missed communication between the grandparents, parents, and children. And in China, they are developing the reproductive culture for 3 years. They are using the Chinese approach, not the European approach. I don't know whether it's good or not. So they are trying to introduce this program for children of 3 years of age, and they have to instill this gender differences, that girls should not be beaten by boys, and girls should not beat the boys. On the contrary, so Natalia Shumskaya, FU Public Association. I have a question to Jildis Bakirova. Thank you very much, Jildis, for providing and sharing such a vision of drug addiction. And do you have the state government program, the development and promotion of rehabilitation programs for people who want to cope with this drug addiction problem? Thank you very much for such a question. And this is quite a painful issue for all of us. In the Kyrgyz Republic, at the government level, there are no rehabilitation programs, no rehabs, but there are many private clinics providing rehab programs. And there are many NGOs who are helping us with these rehab programs. We understand and appreciate that rehabilitation is the and in this sense, there is a lot to be done ahead of us. We are very much concerned about these rehabilitation programs, and it requires interaction and collaboration with psychologists, social workers, and maybe those people who can provide some training or education to our clients. Maybe they will arrange some workshops for their vocational training. It requires a comprehensive approach. This rehabilitation process itself, maybe it is quite costly. Maybe therefore this issue is not addressed as of yet. I would like to remind us the statement of our colleague from Uzbekistan. Unfortunately, in Kyrgyzstan, we have the same issue whether our children are selecting properly the foods, the chewing gums, this beautifully packed packed and packaged foods and beverages. When we talk about health, it concerns the Minister of Health, but I believe all of this should start in the family. If the mother or father, they are not trained what to choose, what to buy, and based on this, the children may follow the model of their parents. For example, if the parents are not concerned about this glass of Coke, of the soda, which contains half of the glass is sugar, they are not concerned about this. We have to train and educate our parents, reach out the grandparents, and it is easy to buy the candies, the chewing gums, but no one cares about the implications. Why I mentioned about grandparents, grannies and granddaddies. No Kazakh has died without for overeating the meat, and my grandfather would insist on us drinking tea with sugar, for which he insisted for a better functioning of the brain. And the most important, my daughter, she drinks only water. She doesn't drink any tea. She is more for water than rather than tea. So this is very encouraging.
So you also mentioned that we're having less of the opium consumption, the same in Kazakhstan, but in the European countries it is increasing, and usually this is cyclic. So, and some narcologists believe that it would be better to have opioid dependence rather than having the psychoactive substance, because just 6 months of use of psychoactive substances may completely destroy the personality. And 40% of PVIDs are being not covered by the substitution therapy witnesses certain barriers, and these barriers should be eliminated to make the full coverage, and the public should get more involved, and I believe this will be becoming the global demand and global trend. So we should recognize that we have a lot to do. Good day, my name is Madina Taktagulova. I represent this association of people who inject drugs, exactly as that is the community been discussing so far. And I would like to point that we all know that fighting is not a solution. And most probably we should be arriving to some equal partnership with the community involved, working with the international community, and most importantly, working with people who have taken the rehabilitation program and completed it successfully, because then these peer-to-peer communications are more efficient. Some years ago in Kyrgyzstan, this approach was well supported by the donor community and by some governmental structures, but unfortunately every year we have reduced funding, and the harm reduction alone is not a solution. Aida is next to me, she's my physician, she's here, and she helped me a lot. Some years ago she referred me to the self-help groups, and then people from the community tried to get united and to do everything possible and even impossible to reduce our numbers, to have less people who inject drugs. And you know, internally, each of us, each PVID wants to cure himself, herself. In the beginning, it is kind of a romantic, but then it gets dramatic. And you see, there should be some comprehensive approach in place, because just to go and to take detox program, this is not efficient, and rehabilitation alone is not efficient either. But if we are united, if we function as true, genuine partners, it's not like we physicians, we know better, or we then community people are advocating that we know better. No, this will not work out. And I want this conference to serve as a starting point of the updated new spirit of unity. Only through the unification, only through this effort to be seated together with the MOH, with the Ministry of Interior, we can do much better and way more than it is done alone. And here we're having representatives from the international community. Please have it as heard. Please, we want to be heard. So let's not divide each other. Let's get together. Thank you so much for being here with us at this conference, and the recommendations given by you are of highest value. So let's work together. This is a big issue. And now, if there are no questions left, one more question. But my CBS Public Foundation thoughts on and coalition for the budget advocacy. First of all, every report was exciting, everything was interesting, and I have questions almost to each and every speaker. First of all, to you, Bahit Nizbekovna, I know you through the email correspondence. Why harm reduction approach is of high interest to me? Because I was the one who was a pioneer to start it here in country. And now I'm interested about the new trends, yeah, because the concept as it started initially and the concept which has evolutionized, what are the differences? And what should be given more focus and its updated version, because this is not just a harm reduction in relation to those who use drugs, but also this should be harm reduction fighting with wrong information and low awareness. Elmira Ravkhatovna, when you spoke about physicians, when they get united, it is much more efficient. And this is the importance of the scientific database, the database of the evidences. You've mentioned 2.5 billion. In our advocacy, budget advocacy, we promote the sufficient funding for health budget because it is completely insufficient to support health of people. Do you have any methodologies that you can share with us? Because each methodology has certain directions to give us some guesstimates what are the solutions. Nadezhda Mikhailovna, she mentioned the public councils. Yes, in the beginning we had NGOs and the public councils established. They were quite successful, but right now we have some political pressure and it ceased to be efficient, and your public councils are still efficient. And but here in our country, in Kyrgyzstan, there are efforts to shut down the public council institution. And Alfia Eldarovna, you said that the prevention is well established. According to my data, the prevention is heavily underdeveloped, underfunded. We are trying to give more focus to preventive activities and interventions, but first we need to make amendments to the laws. When I tried to amend the laws, the answer was that the health regulating items and provisions are spread among different laws and they are not consolidated in one law. And the last question to Jildis Bakirova. I can see that among teenagers, there is a new trend. Young people don't care about heroin; they are more up to the chemical types of drugs. Why we don't raise the question of the preventive interventions for teenagers? We don't have any agency or any system to cover the teenage population. It's done by the NIH. So these questions are very important, are very vital, but because we have only 3-4 minutes left before the end of the first session, and you still have 1 day and a half to go. And during the breaks, you can approach each of us and we can talk to each other because we all, your questions want to be answered. And you, as a committed person, what you have done to address these issues, and you may share your ideas as well. I tried to wrap up what we have discussed. Yes, we need to improve the informational work, informational and educational campaigns. And the COVID pandemic, which is still in progress, served as a strong factor to enhance our activities. There is a big pool of people who are against vaccination. And that was a total mess, what to do, to be vaccinated or not to be vaccinated. And now, after the COVID pandemic, we are having the outbreaks of measles, which is also quite dangerous. And we are kind of underestimating the importance of informational work. So prevention, health education, treatment and support for chronic patients. And the entry point should be the informational work and advocacy and health promotion. At Almaty conference on PHC strategy, we've discussed that it should be patient-oriented system when you deliver healthcare services for patients. And that was the 40th Health Summit. That was the anniversary summit conducted, and Astana has given the attention to the prevention as a cost-efficient measure because earlier you start, less of organ transplantation, so to speak, cases will be needed. But our advocacy and health promotion work is done not by the inpatient level, but you see the ministerial posts should be held by the specialists in public health. The stronger is prevention, less beds we need at hospitals. And because we have increased the bed capacity due to the COVID pandemic, we are facing risks that there will be excessive hospitalization rate. And I would recommend you to listen to the presentations. Tomorrow we will have the presentation to be done by the experts working in Kyrgyzstan. Yes, we need to increase the funding for the health budget so that the PHC level is funded more, and then there will be less demand for the inpatient services because the demand triggers the supply. I started myself as a GP some time ago, and each physician, let's say surgeon, who does appendectomy, is interested to get more such surgery cases because then it is the basis for the remuneration rate. But someone should be taking care of the patients to serve as a barrier to stop the handover of the case from the outpatient level to the inpatient level because of the complications. And as the representative of NGO just mentioned, it's very important to work in partnership between the public sector and non-governmental sector. And today we have narcologists from different countries joining us, and the deputy director of the health department of Almaty city, she's with us today. And this again confirms that we work in a partnership, and we shall be able to address them if we are together. And yes, we had such cases in the past when certain products or activities were prohibited, like abortions were prohibited during the Soviet times, which in fact indirectly increased the numbers of abortions. So such punitive nature of activities increases smuggling activities, counterfeited and fake products caused 22 child mortality cases. That was something of paracetamol type, temperature regulating medicine. So you see, the snake is a symbol which is quite correct, because if it is an overdosage, you may cause death. So it's very important to increase public awareness, and the mass media is your biggest friend. And therefore they should be more involved. And prohibition of unhealthy products is not very efficient, because it's more efficient to replace rather than prohibit. Well, prohibitions could be also integrated, but in the sensible range, like selling tobacco products for those above of 21 years old. But they get AK machine gun when they turn 18, when they go to the military service, and they start smoking from 14. So by 21, they are already chronic smokers. That's why it's important to start out our interventions at earlier age. Sorry for talking too much. You can use my old age as an excuse for that. So stay healthy. And now it's time for coffee break.